Bloating is a common digestive issue that affects many people at some point in their lives. It's that uncomfortable, full feeling in your belly that can make you feel like you've swallowed a balloon. While it's often not serious, bloating can be frustrating and sometimes even painful. Let's dive into what bloating really is, what causes it, and how you can find relief. At its core, bloating is a sensation of pressure or fullness in your abdomen. It's often accompanied by a visible swelling of your belly. This swelling can make your stomach look and feel larger than usual, sometimes to the point where your clothes feel tight. It's important to note that bloating is different from water retention or fat gain. While those conditions can also make your belly look bigger, bloating is specifically related to gas or digestive issues in your gastrointestinal tract. The prevalence of bloating is quite high, affecting up to 30% of the general population. It is more commonly reported by women, particularly those who suffer from irritable bowel syndrome, IBS, or other gastrointestinal disorders. Causes of bloating. The causes of bloating are numerous and can vary from person to person. One of the most common causes is simply eating too much in one sitting. When you overeat, your stomach stretches to accommodate the extra food, leading to that full bloated feeling. Eating too quickly can also cause bloating because you're more likely to swallow air along with your food. Certain foods are more likely to cause bloating than others. Foods high in fiber, while generally good for you, can cause gas and bloating, especially if you're not used to eating a lot of fiber. Beans, lentils, and some vegetables like broccoli and cabbage are known for their gas-producing properties. Dairy products can cause bloating in people who are lactose intolerant. Artificial sweeteners and sugar alcohols, often found in sugar-free foods, can also lead to bloating in some people. Carbonated drinks are another common culprit. The bubbles in these beverages introduce extra gas into your digestive system, which can lead to bloating. Even something as simple as chewing gum or sucking on hard candy can cause you to swallow excess air, potentially leading to bloating. Sometimes, bloating can be a sign of an underlying digestive issue. IBS is a leading culprit, as it often involves a hypersensitive gut that reacts strongly to certain foods and stress. Other conditions like celiac disease and small intestinal bacterial overgrowth can also cause chronic bloating. In these cases, bloating is often accompanied by other symptoms like abdominal pain, changes in bowel habits, or weight loss. Hormonal changes can also lead to bloating. Many women experience bloating before or during their menstrual periods due to fluctuations in estrogen and progesterone levels. Similarly, some women report increased bloating during pregnancy or menopause. Certain medications can cause bloating as a side effect. Antibiotics, for example, can disrupt the balance of bacteria in your gut, potentially leading to bloating. Some pain medications and iron supplements are also known to cause digestive issues, including bloating. Symptoms of bloating. Now let's talk about what bloating feels like. The most common sensation is a feeling of fullness or pressure in your abdomen. Your belly might feel tight or stretched out. Some people describe it as feeling like they've swallowed a balloon that's been inflated inside their stomach. In more severe cases, bloating can be accompanied by abdominal pain or discomfort. This pain can range from a dull ache to sharp, cramping pains. Bloating often comes with other symptoms as well. You might experience increased gas, leading to burping or flatulence. Some people feel nauseous when they're bloated. You might also notice changes in your bowel movements. Either constipation or diarrhea can accompany bloating. The visible symptoms of bloating can be quite noticeable. Your stomach might look visibly distended or swollen. You might find that your clothes feel tighter around your waist. Some people even report looking pregnant when they're severely bloated. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of bloating. Diagnosing the cause of chronic bloating usually starts with a visit to your doctor. They'll likely begin by asking about your symptoms, diet, and medical history. They might ask you to keep a food diary to help identify any trigger foods. A physical examination will usually be performed, which might include pressing on different areas of your abdomen to check for tenderness or swelling. In some cases, further tests might be needed. These could include blood tests to check for celiac disease or other conditions. A hydrogen breath test might be used to diagnose lactose intolerance or small intestinal bacterial overgrowth. In some cases, imaging tests like X-rays or CT scans might be used to rule out other conditions that could be causing your symptoms. If your doctor suspects a more serious underlying condition, they might recommend an endoscopy or colonoscopy. These procedures allow your doctor to look inside your digestive tract and check for any abnormalities. Treatment for bloating. Treatment for bloating depends on its cause. If your bloating is related to your diet, making changes to what and how you eat can often provide relief. This might involve avoiding trigger foods, eating smaller meals more frequently, or chewing your food more thoroughly. If lactose intolerance is the culprit, you might need to cut back on dairy or use lactase enzyme supplements. For bloating related to IBS or other functional gastrointestinal disorders, your doctor might recommend medications to help manage your symptoms. These could include antispasmodics to reduce abdominal cramping, or medications to address constipation or diarrhea if these are issues for you. If your bloating is caused by small intestinal bacterial overgrowth, antibiotics might be prescribed to restore balance to your gut bacteria. For bloating related to hormonal changes, hormonal treatments or birth control pills might be recommended. In some cases, probiotics can be helpful in managing bloating. These beneficial bacteria can help improve your digestive health and reduce gas production. However, it's important to choose the right probiotic, as some types can actually increase bloating in some people. Home treatments for bloating. One of the simplest things you can do to relieve bloating at home is to eat more slowly and mindfully. Take your time with your meals, chew your food thoroughly, and try not to talk while you're eating. This can help reduce the amount of air you swallow with your food. Keeping a food diary can be incredibly helpful in identifying your personal trigger foods. Write down everything you eat and drink, along with any symptoms you experience. Over time, you might start to see patterns that can help you avoid foods that cause you to bloat. Peppermint tea is a popular home remedy for bloating. Peppermint has natural antispasmodic properties, which means that it can help relax the muscles of your digestive tract, potentially reducing bloating and gas. Ginger tea is another good option, as ginger can help speed up digestion and reduce inflammation in your gut. Regular exercise can help keep your digestive system moving and reduce bloating. Even a short walk after meals can make a difference. Yoga can be particularly helpful, as certain poses are designed to aid digestion and relieve gas. Reducing your intake of salt and high-sodium foods can help if your bloating is related to water retention. Similarly, staying well hydrated can actually help reduce bloating, even though it might seem counterintuitive. Other than that, applying heat to your abdomen can help relieve bloating discomfort. Try using a heating pad or taking a warm bath. The heat can help relax your abdominal muscles and potentially help trapped gas move through your system more easily. Over-the-counter remedies like simethicone can help break up gas bubbles in your digestive tract, potentially providing relief from gas-related bloating. However, it's always a good idea to check with your doctor before starting any new medication, even if it's available over the counter. Stress can also exacerbate bloating for many people, so finding ways to manage stress can be helpful. This might involve practicing relaxation techniques like deep breathing or meditation, or finding time for activities you enjoy. Remember, while bloating is common and often harmless, persistent or severe bloating can sometimes be a sign of a more serious condition. If your bloating is severe, persistent, or accompanied by other concerning symptoms like weight loss, fever, or blood in your stool, it's important to see a doctor. Now we want to hear from you. Do you or someone you know suffer from bloating? What treatments worked for you before? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.